Dr. Murhaf is one of the few surgeons left working in Idlib province in Syria, risking his life to treat people in the last rebel-held area of the country opposed to President Assad. It's been suffering deadly bombardment by Russian and Syrian forces. How is it living in Syria now?
Chaos, actually. It's like hell.
Hospitals have actually been targeted in bombings. Nowhere is safe.
I have a little daughter, and when I see every child, I think about my daughter. It's so hard to me, so hard. I've seen people dying in front of me and suffering. It's a big tragedy. And it's a shame that we could not stop the war and stop the bombardment. So we need to learn more and more about surgery in children.
We have damage control for this care. Who's injured by airplane.
Bombs have more harmful effects on children, physically and psychologically. But war zone medics like Dr. Murhaf have to rely on training and techniques designed for adults, often struggling to save lives and limbs as a result.
This is Turkey there.
Today, he's crossing the border from Syria into Turkey for just a few days to try and change that. He's come to this specialist centre for people who've lost limbs in the conflict in Syria. In this classroom, he and other surgeons are being trained on this new manual.
Urobastry, this will vary a little with the size of the child.
It's been specifically designed to teach medics to treat blast injuries in children and was requested by Syrian doctors. It's been created and written by charity Save the Children and scientists at Imperial College London. Hi.
Hi.
This is Dr. Malik, the medical director of the centre.
In this room, we do the fitting and the training to use the artificial limbs.
There's space for recovery here, as well as construction of new limbs for those injured.
So the product will look like this.
And that's ready for someone to use?
Yes.
Saeed is 7. When he was just a year and a half, he was in his car with his whole family, trying to flee aerial bombardment in Aleppo. But one airstrike landed so close to their car that shrapnel pierced the whole vehicle. Saeed, whose name we've changed, lost his sister. His brother lost a leg. He was sitting on his mum's lap, and shrapnel amputated both his legs. What is Saeed having today? What are these men doing with his legs?
So Saeed currently is doing an adjustment for a newly constructed socket for his limb. He needs to do an adjustment to the bone every 1 year and 1.5 years because the bone will keep growing, but there is no skin or muscles to grow with the bone, so it will be painful. So unfortunately, Saeed needs to go under operation every year and a year and a half. They will cut open the amputation location, adjust the bone length, and then sew it out again.
This sort of problem is why treating a child with a blast injury is just not the same as an adult. Dr. Mustafa is another surgeon who's crossed over from Syria today for training. He's a specialist urological surgeon, but like so many of his colleagues in Syria, has had to become an expert in treating often horrific trauma.
I remember one day we received many patients in an emergency room, and there was a woman about 20 years.
Dr. Mustafa discovered the woman was around 7 months pregnant, but her uterus had been pierced with shrapnel.
I took her to the operation room, and then we opened her. The embryo dead, but the mom was very, very good after about 10 days of the operation. But she has no embryo, no child, and no uterus. She can't have a baby at all.
But you were glad you could save her.
We can save her, yes, but I didn't know actually if she want to save her. Okay? Ah.
Because she was so devastated. Why did you decide to stay and do this kind of work?
Because I'm a doctor, yes, and this is my country, yes. Yes.
Dr. Mustafa showed me a picture of this baby, but it's too upsetting to show. The doctors all have stories of horror like this, things you can never forget. This new blast injuries manual has been written to try and help these doctors. It's totally unique, nothing like it has ever been written, and it's designed for war zones. One of the people who worked on it at Imperial College London is Dr. Emily Mayhew.
We got a lot of doctors in a room and said, if you're treating a blast-injured child, what is it that you need? And they actually said, we need a little book. We need just a little book that gives us the basics, that allows us to adapt what we already know for children.
It feels almost like it couldn't be enough, like a little book couldn't possibly teach someone to treat something so catastrophic.
I'm conscious that we need an encyclopedia, that we need a room's worth of pediatric specific information. But that doesn't exist anywhere. It doesn't exist here in the UK or in the US in some of the best resourced hospitals and universities. So this is a start.
The crisis is not over in Syria. A lot of patients, they're scared, there is not enough staff to help them. And as a Syrian, I have to stay and help my people.